All right, everyone. Welcome to the Fall 2020 Health Careers Week Current Professional School panel. Today, I'd like to introduce you to a couple of students. I'm going to introduce everybody who's supposed to be on the panel because one did just sign in and then log back off, and another one should be here a little bit later. So today we have Ms. Morgan Schaefer, a second-year dental student at Ohio State University. Ms. Morgan Horvath, a second-year dental student at Ohio State University. Mr. Mitch Skinner, an M4 at the University of Cincinnati College of Medicine. Mr. Nicholas Henkel, an MD-PH student at the University of Toledo College of Medicine. And Mr. Breger Strictly, an M1 at the University of Toledo College of College of Medicine. I'll start off asking a few introductory questions to our panelists, but attendees, please feel free to submit any questions that you have in the chat, and we'll try to get through as many as possible. Panelists, for this first question, I will go ahead and read out your names in the order that we'll have you answer them. But from then on, if you just want to hold that same order, it'll save time. So for our first question, if you'd like to add anything to the introduction that I just made about you, please go ahead, including your undergraduate institution, anything that you know might be of interest to the students that you currently are going through in relation to your professional school. We'll start with Morgan Schaefer.
I currently don't have a lot to add. I graduated from Miami just in 2019, and I was a kinesiology pre-health major.
Great. Mitch?
There we go. Hey guys. Yeah, so I'm an M4. I went to Miami. I graduated in 2017. Currently, in my last year of med school, wrapping it up. I'm going to end up doing emergency medicine, and I studied just biology at Miami. I'm just the generic track pre-med.
Nicholas?
Hey guys, I also went to Miami. I graduated in 2016. I was zoology and neuroscience double major, I guess at the time. Just zoology was my principal, and I had the neuroscience co-major, and then I minored in Spanish. Yeah, and I've been at Toledo. I took a gap year after Miami, and I started med school in the fall of 2017. And I'm currently in my second year of graduate school. So I did my first 2 years of medical school, and in my program, we enter graduate school for a research component for the PhD right after that. And then once I'm finished with my PhD, I will return to medical school to complete my, my clinical rotations and my M4 year.
Thank you. And Morgan H.
Hi, so I'm also Morgan, and I'm in dental school with Morgan. So we're at Ohio State, and I'm a D1. I went to Miami, and I actually majored in business, so just a little bit different. I kind of wanted to get the business aspect of it because I knew being a dentist that you have to, deal with patients in your business as well. So a little bit of a different background, but I still did the pre-med co-major. And yeah, now I'm here in Columbus Dental School. So and I'm a D2. Did I say D1? I think I might have. I'm in my second year.
That's okay. We're all a little confused with the way the school year's been going. So this is actually a great panel because we're split, 2 dental and 2 medical, but we also do have an MD PhD. So feel free to take this question any way you want to related to your education or your future career, but please describe the profession for which you're currently training.
Okay, so dentistry and broadly is the study and practice of dental and oral medicine. So a big thing in dentistry is preventative medicine and care. So at the forefront, our aim, both the profession partnered with the patient, is to prevent from the ultimate showing of disease. And then when and if that appears, that's when we can step in and much more hands-on ways, like with like treatment and procedures and stuff like that. But a cool part is our emphasis on preventative medicine from the get-go.
Yeah, and then being in medical school, you're training in general just to be like a doctor. It's a whole bunch of specialties to choose from, which you kind of start to figure out your first 2 years, really hone in your third year, and then you make that decision your fourth year. And I chose emergency medicine. I think it's a great specialty. It's a good mix of a bunch of things. Without getting too specific, you can kind of see everything that walks into a hospital. You're the first person to see it first. It's kind of what I like about it. But other than that, you're still just a general doctor. It's kind of how that goes.
Yeah, so just pretty much the same exact thing as Mitch. Just gonna follow up for many that if you don't know the structure of how med school works, most programs, I think the majority of them are structured where it's preclinical class work, book work, some clinical exposure the first 2 years, and then your third year, you do your clinical rotations in your core specialties, and then your fourth year is when you do electives, potentially for your specialty, and the majority of that time is dedicated to applying for residency. But for me in my program, because you can split the preclinical from the clinical work, that's when they sandwich in the research component to actually get a PhD. So for me, I do want to see patients. I do want a clinical practice. I don't know what type of doctor I want to be yet. I have always loved neurology and the brain, so it's kind of my main focus right now. But it is my hope to run my own independent research program, whether it be clinical trials or basic science research, in conjunction with my clinical practice.
So yeah, basically echoing what Morgan said, and then also kind of what Nicholas said. So we have 2 years where we're basically just in classes and working on fake teeth, and then our third year we get into the clinic and work more with patients and just a few classes. And then afterwards, you don't have to specialize if you don't want to. You can, but that adds more years than the 4 that you're in dental school. And then also you can do general practice residency, just kind of enhancing your general dentist knowledge. So.
Awesome, thank you. So I'm going to ask one more of the questions I sent you, and then we'll go to the chat. Why did you select this particular pathway?
So I initially, before like coming into undergrad, shadowed a lot in the different healthcare fields. And I really love dentistry because I felt like a lot of my local dentists had really close relationships with their patients and knew them like on a pretty personal level. And that was something that I was really looking for. In addition, I've just always been somebody who wanted to like have a more active career and work with my hands. So that was something I really loved about dentistry, and the opportunity to be very detail oriented. And then in another sense, I kind of like was looking to my future and about things that I wanted to prioritize in my life. And something that was really attractive to me about the career field of dentistry was the work-life balance and the opportunity to, like, for myself someday to have a career, but also feel like I could be a present mom. And so those were kind of like all my different reasons for choosing dentistry.
Yeah, as far as med school goes, I came in thinking I wanted to be a surgeon, like do surgery. Kind of the only pathway to get to that is to go to medical school. Ultimately ended up just choosing and chose emergency medicine. I was pretty happy about it. I guess the reason I didn't do the MD PhD like Nick did is I just don't see like research being a huge like point in my future practice. So didn't think it added anything to my future career, and so just decided to be a generic MD instead of having that extra tag.
Yeah, so I had always kind of knew I went into undergrad as a pre-med. I knew I wanted to be a doctor, some type of physician, but as part of being a pre-med, you're you're told to do research, I get involved with it. And when I finally did it, I kind of fell in love with it. It fit really well with my personality and how I work and how I operate. And at one point in time, I did consider just doing a straight PhD, but I really still loved working with patients, and I loved the idea of having my own clinical practice. And I worked for an MD PhD in one of my summers in undergrad, and working with him, seeing how he interacted with patients, how he interacted with his research group, and how he tackled the clinical questions, I really fell in love with. So that was it was a good fit for me, and that's why I'm here.
So both of my parents are actually optometrists. So I always knew that I wanted to do something like them, but I honestly didn't like eyes that much. I just have a weird obsession with teeth, to be honest. But also, I think I had like a neighbor and then one of my parents' good friends that were dentists. So I think I just always had that influence and knew I wanted to do something like my parents. I like the hands-on aspect as well. Not that I'm some like super creative person, but yeah, so it was a good mix. And yeah, kind of like Morgan said, having the work-life balance, you know, being a mom, that's important to me as well.
Awesome, thank you. So we actually have quite a few questions coming in that are for individuals, all of you. So really quick, we're going to do the one that came in that's general, and you can all answer if you want, and then we'll start breaking down individual questions. Would you recommend minoring in something, and does it enhance your application a lot?
So I did not minor in anything, and I think that given discovering some of my interests earlier in undergrad, I might have picked up a minor, but in general, I didn't feel that it was make or break for my application at all. I think that what was really important for me was to excel in the classes that the schools I was applying to considered prereqs, and making sure that that was my main focus. And then honestly, after that, like doing anything that interests you, whether that's like academic or otherwise, as long as you're passionate about it and you can talk about it, I would say go for it if there's a minor that you like really love. But I probably wouldn't recommend it if you think that it's ultimately going to compromise like those classes that they're really going to pay a lot of attention to, how you did well in them.
Yeah, I started out with a minor in like bioinformatics or something like that, and like got halfway through it and just didn't like it. So I ended up changing and dropping it. I would say, like, if it's something you're interested in and you're going to enjoy those classes, like absolutely do a minor. I don't think it definitely doesn't hurt. But as far as doing something just for an application, I don't see any benefit to that at all. Someone with a minor is not going to like jump off the page more than someone without one. So if you're interested in it and it's like classes you want to take, like absolutely go for it. But I definitely want to do it just for the sake of the application.
Yeah, I think that's the same exact advice I would give. I did a minor in Spanish because I loved it. I love learning about it. I almost just did a Spanish major just because I love learning about the languages and love learning about languages. But truthfully, again, like just like Mitch said, I don't think there's any point of doing a minor just to put on your application. Do it purely out of your own interest and your own passions. And truthfully, if you are passionate about something, you should definitely study it because once you get to either dental school, PA school, or medical school, that minor may be the last opportunity you had to really study something. So I think that is my definite advice.
Yeah, kind of just echoing them. My rule of thumb probably for a lot of these questions, like don't do something just to make it has to look good for your application. Like they don't want to see that. They don't want to see a bunch of fillers. They want to see you doing things that you like to do because you like to do it. It doesn't matter if it's riding horses or if it's history or if it's painting, like just something that you're passionate about besides med school or dental school. So yeah, if you love, you know, some subject and you want to study it, then definitely do that. And it doesn't matter if it's not science or if it's not something that has anything to do with dental school or med school. Like if you like it, that's awesome, because you can tell them about it and they'll love to hear it. Like they want someone that's different too. So yeah, that would be my recommendation. I definitely don't think you should be like, oh, I shouldn't major in, you know, biochem or something crazy because you think it will look good. Just do what you want to do because you want to do it, and they'll appreciate that.
Yeah, I think just following up on that, like something I wish I would have known and really followed to heart sooner is that like your individuality is probably your most important quality. And no matter what school you apply to, they're going to pick up on that. So follow your dreams, follow your interests for sure.
Great. Okay, so a few questions for Morgan Squared. How many hours of shadowing do you recommend for dental school? What research experiences did you have in undergrad? And do you recommend leaning towards a specialty in dentistry before applying to dental school? I can repeat those if that was too much, but those are specifically for the two of you.
Okay, so first off, shadowing hours, I think that the hours might have changed recently. I think in total, the required hours for applying, in total, I did 120, I believe. I want to say that when we applied, it was 80 hours that were necessary. And I think that it's important to shadow for as many hours as you think is necessary to solidify that this is an interest for you, and also to just like kind of diversify your scope of the profession in and of itself. Like whether you're I think it's really valuable to see how different people run their practices. So to shadow different people, but then also to shadow specialties to kind of get a taste of whether or not you might be interested in those. So then I'll flow into the specialties question next. But I think that something that I was told by an upperclassman while I was at Miami is that it's crucially important for you to want to become a dentist first and foremost, because at the end of the day, there's no guarantee that you will specialize. And you could also like come into dental school, and then once you're, you know, learning all about like general dentistry or learning more specifics about like the chosen specialty that you're leaning towards, you might fall out of love with it. And so I think that at the end of the day, you're absolutely graduating with a DDS or a DMD, like wherever you go. And so it's important for you to want to be a general practice dentist first. And then I did not do any research while in undergrad. That was something that wasn't an interest to me at all. I had friends who did research. I had friends that didn't. And kind of just like echo what we said in the last question, I was told by admissions like early on in undergrad that they would much rather that I didn't do research and that I pursued things that I loved and I was passionate about, rather than just doing research for the sake of doing research. I would say that that is the biggest takeaway that you guys should all get, like if nothing else, to just be like 100% true to yourself, and don't do anything that you think that they want to see if it's not something that you're absolutely in love with.
So how many hours of shadowing do you recommend? I think that I feel like different schools are different. So I think Ohio State's different than other schools. Definitely get the requirement. But again, if you want to do more, but don't do it just to put it on your resume again. And if you do have 1 million hours, then you better be talking about that, because you better love it. And in your interview, you know, that's something that you really want to bring up and express, is your love for shadowing and seeing different practices. And they're going to want to see that you have a lot of knowledge on that if you do end up doing that. But I don't think it's like they see that you got the bare minimum and they're like, oh, like, you know, that's not what we want to see. They don't, as long as you get the minimum requirements, that's good. But also just make sure that, like Morgan said, you know, you solidify that you want to be a dentist through that. Research, I did none. Again, not interested. I don't think it matters. If you want to do it, but they're not going to fault you if you don't do research. And then, yeah, what Morgan said, you're applying to dental school. You're not applying to endodontics or orthodontics or anything like that. They want to see that you want to be a dentist. So I wouldn't, you can think that, but your mind's going to change. Trust me, you get in here and it's way different. And you also have to get like super good grades, and there's a lot of components to it. So I would just want to be a dentist at first. And then there's one other question between those that I was just going to answer really quick. And it was what you do in your first year of dental school. So we start at Ohio State, at least. Every school will be different, but we start on teeth right away. It's called a typodont. It's like fake teeth. So you'll drill your first week of dental school and just kind of get a feel for that. You have like oral anatomy and operative, some different classes like that, but your main class will be anatomy. It's pretty substantial. It's kind of all you focus on your first year of school, because it is like 7-8 credit hour class. But so off of that, I would kind of recommend maybe doing anatomy later so you remember some of it for dental school. So taking that class a little bit later in your undergrad. Not a big deal if you don't, but just a recommendation.
Great. One more question. What kind of work do you do in your first year of dental school?
So Morgan just hit on that quite a bit, but I think probably the only other thing that I have to add to that is just it's the biggest lesson to learn from the first year of dental school is time management. Dental school is definitely a different animal in the sense that you're balancing a lot of hand skills work with your book work. And I very hopefully and very naively wanted to come into school and be one of the students that just hand skills came really easily to. And that wasn't it, and that's okay. And there's a lot of different things in place to help those who are struggling with hand skills. There's remediation that occurs during the following semester, if you were struggling with a particular class, and also programs during the summer at Ohio State, that's called Aim High. So there's definitely programs in place to help those that are struggling with hand skills, because that doesn't come easily to most people, and you're very lucky if it does. So.
Great, thank you. So for those of you attending this, if you open the Q&A box, Mitch and Nicholas have been doing a good job answering some questions specifically for them, because they were getting quite a few. So you can read through that. I'll also make sure that I share that transcript later on. But Mitch, I do have a couple questions for you from the chat. What made you decide to focus on emergency medicine? What aspects appealed to you? And what would you recommend students do once they enter medical school to stand out to residency programs? And what is the process of matching like?
Yeah, you guys are really testing me here. I'm going to start residency interviews here in a month or so definitely going to get these questions. But for emergency medicine in general, I think it's a really good mix of specialties. You get to do it's a little hands-on surgery. There's a lot of primary care. There's the breadth of medicine comes to emergency medicine. You're really the first person to kind of lay your hands on every patient that comes in the hospital. And one of my mentors has this saying anyone, anywhere, anytime. And you kind of take care of every patient, no matter where, no matter when. We don't turn people away. We're the only people in the hospital that can kind of say that, we're there to take care of everyone. And I really like that. And then it's also, as you go through medical school, you kind of start to realize who you want to be who you're most interested in, and kind of the residents that you click with. And I just got along really well with emergency medicine residents, and ultimately it's kind of where I ended up. As far as standing out for residency programs and matching, it's similar to getting into medical school. They want to see people who did things they're interested in, took an active role, got involved, had leadership. A lot comes down to board scores, just kind of like the MCAT. So those are obviously really important. And then the match process is like an interesting, stressful time, but right now, so like September, you put in your application, then you'll interview November, December, and then after you interview, you take all of your programs and you rank them 1 through whatever, and all the programs take every applicant that they interviewed and they rank them 1 through whatever, and then it goes into this algorithm that someone created at some point. It actually won a Nobel Prize, but it goes into this algorithm and they do this big match process, and then you open an envelope and that's where you go for the next 3 to 7 years of your life. So that's how that goes, but that's further down the line. I wouldn't be too stressed out about that right now for you guys. Like, focus on college, focus on getting into med school, and then the rest will figure itself out.
Great, thank you. Nicholas, there's a couple questions in here for you. So how many years total is the PhD component of the MD PhD program? And do you feel that your clinical skills diminish during your research years? Does your program have curriculum put in place to keep clinical skills sharp while you are doing your PhD?
Yeah, so it depends on the school for the length of the PhD. Toledo, that's where I'm at. Usually the PhD students kind of like on an accelerated track. We're fortunate because all of our preclinical work serves as a prerequisite for the graduate coursework that we would have to do otherwise. There are a couple of classes that I had to take just as part of the research curriculum, but it wasn't as extensive as what I needed to do for the first 2 years of med school. So we'll probably be doing a 4-year PhD. So that means a total of 8 years for the dual degree. But some schools, some programs expect a PhD student, an MD PhD student, to be in there as a normal PhD would. So depending on your mentor, your project, your department, your funding, whatever it may be, your luck for that matter, you could be in a PhD program just in the MD PhD component for 6 to 7 years. So it's highly variable among programs. So if you are seriously considering looking at those programs, it would be an important conversation for yourself and whoever your eventual mentor is, the lab that you go into, about the timeline for completion of your project, because at one point in time you have to consider the return on investment. So if you're going to be in school for 10 years for 2 degrees, that could mean that you're missing out on potentially 6 years of real salary. So there's really, really important questions, and it's definitely no small feat to take a part of. And yes, with the clinical skills component. So in my program, I have an MD PhD elective where I can pick the specialty I want to rotate through and that I want to see, which is nice because I can kind of pick and choose my interests. So I did a rotation in neurocritical care in the neuro ICU. And then I'm also right now doing a rotation in pediatric neurology. But yes, I think it causes me and a lot of my other peers some stress about the loss of clinical skills because it's very different when you're an M1 and M2 or even an M3 where you're in the clinical setting every single day and you're learning exponentially every single day something new and how to manage patients. But with the dual degree, you have another set of criteria and another set of expertise to learn. So there's a little bit of a payoff there. But almost any accredited school is held accountable for making sure that the MD PhDs still maintain clinical competency. So that is something that we all are actively participating in so that we can sharpen our skills and make sure that when we get back to third year for our clinical rotations, we're adequately prepared, despite the fact that we have been in research for, up to 5-6 years.
Thank you. So we'll go back to a couple questions for everybody. What was your process for studying and taking the MCAT or DAT? Is there anything you recommend or don't recommend?
So for the DAT, there's a really great online program called DAT Bootcamp, which is what myself and the majority of my friends utilize for studying. I think that at Miami, we're super lucky to have that like J-term period now that can be utilized for studying so that it doesn't have to be like a shared focus with your classes during a normal semester. I spent that entire 6 weeks of J-term studying for the DAT. I know some friends that did it in 4. You can definitely like do it in less if you feel really confident, or if studying just comes easy to you, you tend to spend less time and you know that about yourself. I would caution the idea of, only leaving yourself 4 weeks. I think that, maybe giving yourself the space to have a little bit longer to study is a positive thing, and then not needing it versus wishing that you had the time later. But DAT bootcamp was perfect. It's formatted in a way that it takes you through all the material that you need to know for each of the different sections of the DAT, and it gives you not only practice subject exams, but then also like full-length practice tests that are formatted in the exact same way that the DAT will be when you take it officially. And that was really helpful just to become like comfortable with the process and the setup of the exam. I'm trying to think if there's anything else. Yeah, I will echo what Morgan said about kind of like how she said that it's helpful to take like anatomy sort of like close to when you're entering into your first year of dental school. I think that it was helpful, really helpful, to take physiology right before I took the DAT. That was something that came in really handy because that was like a bulk of a lot of material that was tough to get through. So.
Yeah, I'm a little removed from my MCAT studying, so I'm not totally sure how long I studied for. I do know I like attempted to study during J-term, kind of like Morgan said, and it just didn't work for me. Like I couldn't do it from home. Probably if I would have stayed on campus, it would have worked. But so I remember I moved my MCAT back, and I probably studied for like 6 weeks or something like that. I did it my second semester junior year, and I took a pretty light class load, so that way I could do that. Yeah, and I did one of the Kaplan courses, which I personally found to not be that helpful. That's kind of like my own personal learning style. I had a lot of friends who took those courses and loved them, and I think they helped out a lot, but I personally didn't. I just didn't find it that useful. So yeah, kind of find what works for you. Talk to some people who are like juniors and seniors now who have like taken it or already taken it, and see what they did and see what they recommend, especially if you have upperclassmen who you've studied with in the past and like you kind of study the same way, see what worked for them and do that.
Yeah, so I'm gonna be honest, it's been a real long time since I've thought about the MCAT. Like it's been a minute, guys. But I also did, if I remember anything, it is that I did take a Kaplan course, and I want to say, just please take this with a grain of salt, because you're going to hear it from two different people, and everyone has a different learning style. But I personally did not find the Kaplan course useful as well. But I know some people, again, that did. It just depends on your learning style, and you can always reach out to me if you want to talk about that experience more, but it just wasn't conducive toward my learning style. What it was helpful for was the fact that Kaplan gave you a lot of good practice tests. And if medical school has taught me anything, one piece of advice that I will give you and that you should heed is that you should be doing, when it comes that time, I would spend more emphasis on test taking strategies and actually doing questions rather than reviewing raw material. And Mitch, if you have a comment on that, like, feel free to pitch in, but I think that's going to be the most helpful thing. For other supplementary material, if I needed it, the Princeton Review series was very good for just pure content and some questions as well. But yeah, so questions, probably the most important thing. I definitely would have done more of that and more practice tests. And I rescheduled my MCAT a couple of times, and to be honest, don't do that. Pick a date and stick with it and just roll with it and do your best. it'll all work out in the end. I promise. It's stressful, but it'll all work out.
So echoing what Morgan said, I know the med students are saying there's a different studying way for everyone, but I've never met anyone who did not love DAT boot camp. Like, I would trust my life with DAT boot camp. Like, the thing was the same thing as a DAT. Like, the format, like when you showed up to the DAT, there was no surprises whatsoever. It's great. And yeah, I would just use that. That's it. And yeah, like basically everyone I've talked to used that as well. I think it's even better now too, because like when Morgan and I did it, there wasn't like some certain things that I know now that they have, so they have even more resources. And then echoing Nicholas, the practice questions are definitely the most important part of your studying. You can study as much as you want, but until you do those questions, it's just not the same. You learn a lot better from them. And then when you review what you missed and why, and like look through A, B, C, and D and kind of see why the three of them were wrong, that helps you learn too. So yeah, basically that.
Great, thank you.
Yeah, I'll echo that. Like full length timed practice tests are going to be your best friend. They're stressful and they're hard and they're meant to be like that. And you need to be in those situations before you take the real thing.
Awesome, guys. Morgan asked, did you study abroad?
I did not.
Okay, so we have a couple questions about studying abroad. Attendees, you can email me and we can talk a little bit more about that since they don't have any experience in this panel right now. For the Morgans, I think you were the two who weren't majoring in sciences. Was it hard getting prereqs for dental school done as a kinesiology and a business major?
So for kinesiology, it was not a huge deal. A decent amount of the prereqs like did blend into the kinesiology major really well. And so I started out as a bio major and I made the switch because I preferred like the focus that the kinesiology major had over like the broadness of a bio major. And but yeah, all in all, I think it would have been a little bit more cohesive with a bio major, but I didn't have like a big struggle at all with the kinesiology major.
Yeah, so I was a business major. I started kinesiology, and I think I did my first semester as kinesiology, or maybe first and second. And so I did take some classes that, you know, I never got use out of because they're kinesiology classes. I would not say that it was hard. I think if you started junior year and decided you wanted to be a business major, that would be really tough. But I think as long as you start in your, of course, if you have to get in farmer. So as long as you start that sophomore year, you'll be fine. And it really wasn't hard. It's not like I mean, I didn't minor in anything. I had crazy small, I guess I took some classes in the summer just to keep me busy. Like I'd take one or two, I think usually just one, but I don't think I needed to do that. So it's definitely possible.
Yeah, I will say I did really intentionally plan out like my whole 4 years while I was a freshman. And I think that was really helpful. I just talked to upperclassmen that I knew that weren't even necessarily like pre-dental, but just like any pre-professional who's within your major, and kind of like get a feel for what order it makes the most sense to take classes in, what their difficulty level is, because and that really goes for any major, just like strategizing when you take classes, whether it's for the DAT or the MCAT, or because you don't want to be taking all of your hardest classes the same semester of junior year, that sort of thing. I would really advise, like, you know, planning as much into the future as possible, but you can make things work. You have time.
All right, and for you two, again, is there a residency after dental school? If not, what do you do instead?
So I actually don't understand the residency super well. Maybe Morgan can speak more to that, but we do have, so a really nice thing about dental school is that you don't have to have a residency. So the GPR that Morgan mentioned earlier is like totally optional. That's just sort of more, I think, if you want to have more time to cultivate your skills before entering into private practice. But that's something that I really loved about dentistry, was that I was going to be able to go to school for 4 years and then go straight into practice if that's what I wanted. There are many different specialties in dentistry. I think there are officially 9 now. So there are definitely options to specialize if you love doing root canals and really want to do that, or like for periodontics, that's like focused on gum disease. If you want to do prosthodontics, that's like a lot of crowns and dentures and like extreme restorative cases, and oral surgery and a few others. So that's kind of more of the after dental school type slant, but maybe Morgan can speak a little bit more to the
So residency is, not required. If you want to specialize, it is required, and you have to get accepted into a residency. All the specialties have a different number of years. So, oral surgery, that's going to be the longest. That will be 4 years. There are some others that are 4 years. But I think like orthos 3, different ones would be 2 years. But some people do a general practice residency before they go to their specialty because they didn't get in, or they feel like they don't know yet if they want to specialize. And I know a lot of people do the general practice residency just because they don't feel completely confident in themselves when they leave dental school. And so, I mean, they're all pretty competitive to get into. And I know that also different programs have different lengths. So there might be a general practice that's 1 year, some are 2, and even the same with specialties. Some might be 3 years and some might be 4 years. It's the same specialty, just a different school has a different length. So yeah, not required, but a lot of people do end up.
Great, thank you. I'm going to open this question up to all of you, even though they specifically asked for dental school. So if you were giving a first-year student advice about what they should be doing right now, shadowing, working a job, research, anything else, related to extracurricular activities, what should they be doing right now? Should they be doing it right now? When should they start doing this?
So I think my advice would be, this is just kind of like what I did, and I thought it like worked out really nicely. I tried to do my shadowing sort of earlier in my undergrad career. And I thought that that was beneficial, not only to solidify early on that this is definitely what I wanted to do, but because that basically finishing shadowing and like the hours that were required early on opened up more time for me to be much more involved in my extracurricular activities later on, which was important to me because they were things I was passionate about, and I wanted to be involved in leadership and take like a much bigger role in them. So I would say during your like first year or two, I would tackle those shadowing hours and solidify that this is 100% what you want to do. And then at the same time, be exploring different clubs and find out like what you really enjoy and what you're passionate about, whether you love service or, any club, any interest, something that you can take on and make your own in a way that, you can focus on and devote more time to when you're older, because the opportunity to talk about those things that you love so much and were so passionate about that you created a new event for, or fundraised, or brought a new like philanthropy to your campus or something like that. Those are going to be the things that they want to see from you like in your interview. And so that would be my advice there.
Yeah, so for like the first years, the freshmen, the most important thing you can do, especially for medical school, is just like do well in your classes. Don't bite off more than you can chew, especially this first semester. Like really sit down, do well in your classes, take the time to study, learn good study skills. I know a lot of people have trouble coming into college from high school. So learn good study skills, do well in your classes, set the groundwork, because everything you're going to be taking for the next 3, 4, even into medical school, all kind of starts with like general bio and like the general chem stuff. Like you really need that groundwork. So do well, really well in classes your first semester. Around Thanksgiving time, I would email any like shadowing contacts you have or reach out to people if you don't have them. See if you can set some stuff up for J-term. Unless it's changed, medical school doesn't have like a set number of hours you need, but they do want to see that you've shadowed and you are eventually going to need a letter of rec from a physician for medical school. So it's good to build those connections early on. And then if you feel like you have all that stuff down pat, if there's like 1 or 2 organizations that you're really interested in that you want to get involved in, I would say like add that in as you can after you kind of get your grades down. But like the biggest mistake that I see for people is they take on more than they can handle that first semester, the first year. They get in too many clubs and they come out with like a not so great GPA to start out with, and then you're just in a hole and it's really hard to dig yourself out of that. So take the time to do well in your classes now, and then you can build on the rest later.
Yeah, I have, essentially the same exact advice. I think setting a solid foundation for yourself in terms of GPA, just for that security, is always an awesome thing. But it never hurts as well to, just cherry pick a couple of things you're interested in, like 1 or 2 things that you think you can really explore and get into, and just go for it from there. And I don't think I was really cognizant, but I think Morgan also put it very nicely that if you can get as much shadowing done as you can, like before you go, into your sophomore year, during J-term or during your summers, that also just sets up a really nice foundation for you. And let's just say, if you shadow physicians and you decide you don't like medicine, and that gives you opportunities to, maybe nursing, maybe PA, maybe dentistry, maybe being a scientist, just getting that stuff early on really helps for your own career trajectory.
So yeah, I was just going to say the same thing as Mitch. Your grades are for sure most important. So don't start doing a bunch of clubs and things like that if your grades aren't solid. Like if you don't have the grades, you're not going to get in. So no matter what you do, really isn't going to make up for that. So get your grades going. It's no big deal if you do nothing freshman year or, as you're adjusting, and then find things you like and do them. It doesn't have to be research. It doesn't have to be, nothing that you don't like you should do. You just want things that you're passionate about, and just try to diversify them if you can. Whenever you want to do them, try to, wait till you have good grades, but after that, just kind of go for it.
Yeah, I think we had, I'm trying to think who it was, but we had a presenter early on in undergrad, and they kind of like demonstrated the math of how difficult it is to move your GPA after your freshman, and then especially after your sophomore year. And I felt like that was really helpful to kind of just like put myself in the framework of how important those first 2 years were academically. Because I remember once you're in junior year, it's pretty hard to move your GPA around. So definitely, like they were saying, focus those, especially freshman year, but freshman and sophomore year too.
Awesome. That actually ties in a little bit to the next question. So what was the most difficult class that you took for your pre-dent or pre-med pathway, and what was your favorite class?
So the most difficult class for me was physiology. I think that was like a couple of things. I really enjoy the subject, but it just isn't one that comes very easily. It's kind of like a lot of bringing in a lot of different kinds of things together. So that was just one that I had to spend like a lot more time focusing on. And I think knowing that going into the class was helpful, because I had similar feelings with like taking, you know, APs and stuff before. My favorite class was OChem actually, and that's a super unpopular opinion. But the way that I went into it was looking at it like a giant puzzle. And that was super helpful for me to go into the class that's generally like considered one of like the hardest classes that you'll take with not only like a positive attitude, but kind of like I am going to enjoy this, like this is going to be fun. And for those of you that are like more math minded, Gen Chem like might be your thing, but I like to think really visually and abstractly, and so I really loved OChem. So I would say if you're worried about struggling in OChem, definitely like going into it, maybe like thinking about it like as a puzzle would just be like a more positive way to approach the subject as a whole.
Great, guys. Thank you so much. Actually, sorry, I interrupted you. There's more of you.
Yeah.
Go on that question. Sorry, I'm so used to individuals answering. Go ahead.
The hardest class I took was probably biochem. I don't know why that just didn't click for me at all. Like I like bio, I liked chem. I put them together and it just didn't click for me. And then my favorite class it wasn't a prereq or anything, but I took like a horticulture class that I thought was sweet. It was a lot of fun. So like definitely take some things that also aren't prereqs. You're gonna think yourself. But I actually really liked physiology as well. I like that, how that works. So.
Yeah, I'm not a big math guy, so me and physics didn't really get along too well. Like second semester physics, like no, thank you. But I got through it. I think my favorite class was actually not science related. I think that's one of the nice things about Miami is like the liberal arts component. I took world history since 1945, and that was awesome. Just learned so much, and I did that my senior year because I had to fill a requirement, and yeah, it was great.
So my favorite class was also OChem. I don't know, I kind of want to know, is Dr. Erb still there? Because she is just like the absolute best.
Yes, and she's still considered the absolute best. She wins awards every year.
Oh, love her. Anyways, yeah, so that was awesome. And I'm more of a numbers person, so I didn't think that I'd love it, but I loved it. And I would say, I think physics was just taught in a weird way where I didn't like it. Like, I think you don't sit in a lecture hall, you sit at round tables. I don't know if it's still the same thing and you can't see the lecture. I just didn't like the format of that class. So I would say that was my least favorite, but none were, I don't know. Biologies were kind of terrible. I don't know, but I liked OChem.
All right. Is it worth it to shadow specialties that you don't think you'll be interested in just in case? And I'm actually going to also add different healthcare pathways in general.
Yeah, I would say that it's really helpful to shadow other healthcare specialty, well, I guess careers in general. I thought for the longest time that I wanted to be a vet, and then I realized I'd much rather work with people when my mom encouraged me to shadow our friend who was a dentist, and kind of like also shadowed then other healthcare professionals just to make sure that that's really what I wanted to do. In terms of shadowing other specialties, I think that's also really helpful because you'll never know if you really enjoy something or are interested in it unless you've had exposure. And as far as like dentistry goes, like not everyone's had to go to like the endodontist or the prosthodontist, or some people have never even been to an orthodontist. Oral surgery is really, really cool. It's crazy to see them like do reconstructive surgery and really change people's lives in a really dramatic way. So I would definitely encourage you to shadow as many specialties as you can. I wouldn't make that your focus of your shadowing, because like Morgan and I have already emphasized, like you're going to school to become a dentist first, but I think gaining exposure early on is always positive.
Yeah, I think all shadowing is good shadowing. The more exposure you get, especially in the medical field, is going to be good. And you never really know about your specialty. And even what pretty much the specialty you come into medical school thinking you're going to do is probably not the specialty you're going to do. I think like, I don't know what the statistics are, but at least like half change, probably 75% or more. And then as far as like other careers, I would also advise that. I only shadowed doctors pretty much, but plug for PA school for people who haven't shadowed PAs or anything. Like, it's really popular nowadays. You get to do a lot. It's a lot shorter school. Like at the end of the day, I'm really happy I went to medical school. I'm really happy I'm going to be a doctor, but I might not have done it if I had shadowed PA school. I have a lot of friends who did PA and they love it and they have like really good lives. So it's worth taking a look because medicine's not for everyone. It's pretty hard and it takes dedication and it takes a lot. So just make sure you know what you're getting into before you get into it.
Yeah, I don't really have much else to say. I totally agree with that. If you are feeling that you want to see something else, you definitely should. And even if you do it on a whim, you may never know what you come to love. So it definitely cannot hurt.
Yeah, I don't really have anything to add either. That was good.
Great, thank you. That was a good one. So I'm going back through some of the questions that you've been answering in the Q&A and some of the ones that didn't get answered by everybody. So what's the best study skill or habit you took away from undergrad that still helps you now in professional school?
So I think for me, something that's really helpful is I would take all of my notes down directly on PowerPoint. So whether that's like printing it out or just like in a PDF kind of like in notes on your computer and while you're in the lecture, and then immediately following the lecture, reviewing that and piecing together kind of like your notes and different ideas from throughout the lecture, the PowerPoint in like a different kind of color. I know that sounds really simple, but for me, it really helped to, like when I would go back and review, watch the progression of the integration of my knowledge by seeing those like different colors. And I felt like that kind of like helped me track my progress as well. And that's something that I still do. And then preparing for an exam kind of more like immediately before, because I would always study like throughout. I wouldn't recommend like crunching your studying. Do that as little as possible, except when absolutely necessary. But like the week before an exam, I would then like take all of those like lectures that I like made extensive notes on. And then at that point in time, like you've already reviewed it like 3 times by making your extra notes. And then I would kind of I called it a cheat sheet, but basically it's just like a short list study guide of everything when I like went through my PowerPoints that I didn't feel like I remembered upon like reading it. Like I couldn't have like regurgitated that information for an exam. And so I kind of would make that short list. And then by the time like we were reaching the actual exam, I would just be studying the short list. And that's always worked really well for me.
Yeah, I put in the chat, but the biggest thing I took from undergrad was just a system to stay organized. My study technique has changed pretty much. I don't do anything in undergrad now in medical school, but I still use my like same organization style. Like I sit down at the beginning of the week and I open up like a notepad in my phone and I like go through all the things I have to do. And that's just like what works for me. I was never a planner. I didn't like writing things out, but just having a quick reference sheet in my phone is pretty much the only thing I still do. And that's just the nature of how much materials in medical school versus undergrad. Like you just adapt and you find what works for you as you go on.
Yeah, I share the same thing as Mitch. I mean, everything that I did in undergrad, I really had to switch up when I got to medical school. But just holding the principle of like staying organized and keeping your priorities in line, that is what helped the most for me.
Yeah, so I actually started at Miami and played basketball, and so I had no time for anything. So I planned out like every second of my life, and that was something that I have continued to do, and just kind of making sure, if I have a test in 2 weeks, that I have a schedule to where I'm never going to have to cram. I'm just going to study a little bit each day. And that goes along with like I don't procrastinate really at all. Like the day before exams, I'm like, okay, I don't really want to do anything, which I know is super weird and it's easier said than done, but I just really plan everything out. So I study like one lecture a day for how many days how many ever lectures there is days beforehand. And then when it comes down to it, I don't have too much to do right before an exam. So I would just say stay on top of it, especially when you get to dental school. I'm sure med school, it's crazy and you have exams all the time. So if you don't stay up on it, it's not fun.
All right. Does anyone, well, Nicholas and Morgan answered this, but Morgan S. or Mitch, would you like to share what the lowest grade you got in college was?
The lowest grade I got in college, I think I did get a C in one class, just one, and that came down to like a personal reason. I think I saw that Morgan did answer in a chat to kind of be prepared to talk about like classes where you might have gotten a lower grade. I think that that's wise. I wasn't asked about that 1C, and maybe that's maybe they like weigh what they've seen like throughout the rest of your transcript and then they're not worried about it. But I think overall, like like one slip up isn't like a huge thing to like have a ton of anxiety about, like all the way up until whenever you have like applications or interviews or something like that, because they're looking at you as an applicant like as a whole. And I'm sure everybody's going to be a fantastic applicant, and you have like a lot of things that make you who you are, and that's not just like one grade. And that's not to minimize grades, like they are really important, but it's not worth like it's not worth stressing about to like the nth degree.
Yeah. I honestly don't remember. It was either a B or B minus. It was biochem. I really did not like that class. But it was there. I probably had like a couple of other like B pluses or something like that on my GPA, but like at the end of the day, like your overall patterns is most important. And once you get your interview, it's really all about the person, and grades kind of go away. So, it is what it is. Do the best you can, and then be ready to talk about it if you slip up.
Great. All right. What is the difference between shadowing and clinical hours? And do you need clinical hours in dental school? And also go ahead and talk about if you need clinical hours for medical school as well.
I'm not entirely sure what defines clinical hours, so I'm going to go with no, we don't need them.
Yeah, I have no idea what the difference would be between clinical hours and shadowing. And as far as I know, there's no like set requirement. You need to do it just so you can show that you're like interested in the career and like what you're getting yourself into. But for medical school, I don't believe there's a set requirement.
Yeah, they're talking about patient contact hours, which are required for PA school. Did you want to say something? Go ahead.
No, not at all. It's the same exact thing as the other two. Sorry.
Okay. Well, I was just going to go with another one from the Q&A, but these haven't been answered. Did you have a chance to do volunteering or an internship? If yes, what year should an undergrad start to seek one?
So I did, actually, these both happened the summer before my junior year. I went on a missions trip to Guatemala through a program called Global Dental Relief, and that was absolutely incredible. I thought it was fantastic to have a little bit more of a hands-on opportunity, and also just to see the value of care that often can be taken for granted here in the States. And so I thought that that was really powerful, and that kind of like solidified like having a heart to do like international missions for myself in the future. That same summer, I interned at a private practice near where I grew up. And there I worked as a sterilization technician slash like catch-all office intern. And that was really valuable because I like worked in the back and like took care of all the sterilization, but I also learned to help do like a lot of like more minor like lab processing things that you'll learn to do in dental school. And so that was kind of just like fun to get a real grasp on like procedures and setting up and tearing down operatories, and kind of just like getting a big head start on procedures, because there's a different depth to your learning when you're trying to figure out all those things in the practice setting versus just shadowing and observing. And then the benefit that I had from that experience was also learning some of the more like the business side of running a practice. That's a really common thing that dental students wish that there was more of taught in dental school, is the aspect of like running and owning a practice. And I felt like I got some exposure to that and sort of learning more about insurance and that type of thing. And that was really valuable. I was lucky in that sense. That was kind of just like a connection that I had made through like family and networking and shadowing. And that's why shadowing can be really important to just like kind of figure out what opportunities there are for an internship or something like that. Because if it's not the person that you're shadowing, they might have a friend who they know would love to take you on as like an intern for the summer or something like that. So I would definitely recommend either of those opportunities to anyone who has the time.
Yeah, I volunteered a fair amount throughout kind of my 4 years at Miami. I did some things in high school that I just continued on, and then I got involved in different organizations on campus and kept it up. I would say like definitely take advantage of your J terms. I think that's a unique thing Miami does. It opens the door to a lot of experiences. I went abroad on my sophomore and junior J term. I was in MedLife. So plug for MedLife if any of you guys are looking for a new organization. But I went abroad and I went to Peru and Ecuador and did like mobile medical brigades there. And then I did a non-medical internship during the summer of my junior year. I worked for the Ohio EPA in like one of their labs. And that was like a cool experience, but I just did that because I wanted to. It didn't really help my application that much, I don't think.
Yeah, in terms of a time, I think probably once you get more established in your studies, probably like start looking seriously when you're a freshman, see what opportunities there are for you to get involved in like maybe your sophomore year or so. But I was really involved with America Reads, America Counts, and that was just like a tutoring thing. I really love to teach and I love to tutor, so that was a good fit for me. And then I did an internship between my junior and senior year, working for an MD PhD, and that's kind of where I solidified my career interests.
So I also did a bit of volunteer work. I think I started like second semester freshman year, actually at the adult daycare center in Oxford. It's like kind of by the rec, but anyways, it was really fun. I don't know if you're interested, you can contact me about it and I can hook you up, but it was really fun. I just kind of went and volunteered throughout my time at Miami, and I really loved it, and that was something that I talked about quite a bit in my interview and things. So I do think it's very important, you know, as dentists, as medical students, as doctors, you need to be willing to give to others, and so they do want to see that you volunteer your time. I would say start as soon as you can, but, you know, don't stress yourself to where you're not getting good grades because you're volunteering so much or whatever. I think what Morgan did was something I really wanted to do and I never got to do, but traveling abroad, they love that too. And that's awesome. Like, you'll remember that forever. So I would say do that.
Thank you. What was the hardest aspect of being a pre-health student in your opinion?
I think the hardest thing was probably just not losing steam. It's definitely a lot of work, and it's a lot of studying, but it's 100% worth it. Even the long nights or whatever. I think it was sad for me to see people like throughout undergrad dropping like the pre-med major, like people that I felt like could do it or would be really great in the medical field to pursue like a different lifestyle during college. And I think that like that's kind of like a lie that people believe, is that you can't have like a fun like college experience and a balanced college experience, and also like keep in mind and pursue like your long-term goals. And so that looks different for everybody, and it's all about just like finding that balance. But I think it's definitely just about like even when it's hard, and even when the course load is really heavy, it's about remembering your long-term goals and what you want to do and why you want to do it, and seeing the value in the time that you're putting in now.
Sorry, I froze. I missed that question.
Oh, that's okay. So the question was, in your opinion, what's the hardest aspect of being a pre-health student?
Oh, okay. Yeah, probably similar. You have to give up like the normal, I mean, you don't have to totally go with the normal college experience, but it's going to be different. You're going to miss some Saturdays and some Friday nights, and you're going to spend more time in the library than probably like some of your other students. And I think that's hard to sit there because you're going to get peer pressure to like go out and to have fun with your friends, and kind of takes a self-discipline to say no and kind of hang in and do some extra studying. That was probably the hardest part for me, was just realizing that like you're going to have to sacrifice some parts of your college experience, but eventually it's like worth it, and you get to end up where you want to be.
Yeah, I agree. I think the self-sacrifice starts really early on, and I mean, at the end of the day, it is worth it if this is what you want to do, and it's humbling, but it's also extremely exciting once you get here, and it's amazing in my experience, and I think we all share this, just how complete strangers will trust you, and how you can care for them, and how you can learn from them. You learn so much about humanity and whatnot. And undergrad was tough, just trying to get to this point. But I promise it's always worth it. And I think too, what was hard about undergrad and like being pre-health is that there's just so much coming at you. There's so much expectation coming at you. And I think just staying like, do you do research? Do you do community outreach? Do you need a 4.0 GPA, whatever it may be? But at the end of the day, like your individuality and your passions, I think that's what you need to stick with, and you'll be amazed at how successful you will be if you just stay true to yourself.
Yeah, I would just kind of echo all that. I think, the biggest thing is you don't get to do you have to study. So a lot of people don't really have to do much, and you do, but it's a sacrifice that you should be willing to make. And if you're not, then maybe there's a different path for you, but it's definitely worth it. I think we're all very happy with where we are. And we still had fun during undergrad. It's not that you can't have any fun at all. There's still, a lot of time to do things, but maybe not every night.
All right, so we do have a little bit more time, so I'm going to encourage the attendees to ask a couple more questions. But while we wait for that, we've had a few questions about interviews, and some of you have answered a little bit about it, but do you just want to share a little bit of information about either what the process was like for you, or if you have advice for some of these students who are right now preparing to interview in the next few weeks.
So I experienced two different interview styles throughout my process, and one was sitting at a table and being interviewed by like 5 or 6 different people on their admissions council, and that ended up being a little bit more like stressful for me versus my other experience with MMI, because that felt like a little bit more, I don't know, a little bit more poignant and less relaxed. In MMI though, and so for that experience, I was mainly prepared just based on like knowing like my application inside and out. For MMIs, I like tried to prepare by reviewing different kinds of questions that could be asked, like different ethical scenarios that could be thrown at you in particular. Once you get to the interview experience, the main thing, like you've passed the GPA and like a lot of criteria hurdles, and they're much more interested in who you are as a person. So my approach to the MMIs in that scenario was they want to see how you think on your feet. They want to see like, how you deal with tough situations. And they also want to just see who you are as a person, whether or not you're like relaxed and relatable and personable, because that's a really important quality in healthcare, is just being able to relate and empathize with your patients and be able to explain things in a way that's really helpful for them. So for MMIs, yeah, I prepared with a few ethical scenarios, but at the end of the day, my feeling was they just wanted to see how you thought on your feet versus were they looking for exactly a correct, like a specific answer or not. And that style was, we had like a few conversational interviews, and sandwiched in between those were the ethical scenarios, and those were given by either students or professors. So that was my experience.
Yeah, I did both like general normal interviews and also MMIs. Both University of Cincinnati, where I'm at now, and Toledo, where Nick is, that were MMIs for me. I like the MMIs better, I think. They're normally like a whole bunch of small situations. They'll ask you questions. Like Morgan said, sometimes they don't even care what answer. They just want to see like how you got to that process. And they also want to see how you react to different personalities. So you'll get like stone cold faced on some, you'll get people who like audibly like disagree with you. And I think the biggest advice I have for those is every time you leave a room, like that interview's done, you need to drop it, like it's over with, move on to the next one. And then just for the normal interviews, like they're going to ask you pretty much anything under the sun. I think I put it in one of the Q&As, but if you just Google like medical school interview questions, I think like there's like 100 that'll pop up. You'll get asked anything from there. I also interviewed in an election year, like you guys are interviewing now. And so be prepared to be able to answer questions about how like the future of healthcare is going to change. A couple of different policies. They shouldn't, and I don't even think they're allowed to ask like how you would vote or like how you feel about certain things. But like policy is fair issue or it's fair game, and you'll probably get asked that. I think I got asked about like the Affordable Care Act on a couple of interviews.
Yeah, truthfully, not really too much to add. I think one piece of advice that I was given early on, and especially with any type of question, is that if you're asked your direct opinion, be able to state your opinion, why you feel that way, make sure it's logical, but then also at the same time state the opposing or oppositional view, that you have respect for that view and why you believe one thing over the other, and consider the argument. That kind of, I don't want to call it a dilemma, but that type of framework came up a couple of times for me, and I think it was appreciated. It was helpful. Just kind of shows that you're a rational human being. But I think mostly just they want to know who you are as a person, and just kind of have fun with it if you can. just like Mitch said, you're going to have some cold stone faces, and you're going to be like, you're going to walk out of that room and be like, they hate me. I'm not going to get in, blah, blah, blah. And it's all an act. So just play it cool and just stay confident and calm.
Yeah, I got pretty lucky. All of mine were just like conversations. I mean, I had a few, maybe like half of my interviews, I was asked about like specific scenarios you'd have to respond to. But then once you answered that, then it was just like excited for the Buckeye game this weekend, or it was just like conversations. I mean, they just wanted to get to know you and make sure that you were, like Morgan said, someone that can hold a conversation and is personable. So I wouldn't worry too much about them. I know every school is different. I mean, I have heard of some that are pretty terrifying, and they just kind of give you a straight face and don't really give you much to work with, but it's all about how you respond. So like you said, you can Google and find out basically probably what they're going to ask you. I know Reddit has stuff too. So you can find things on what you'll be asked, but mostly, I wouldn't be too nervous about them. Just kind of be yourself.
Guys. For dental school, do you get traditional breaks off like summer?
So
I
that,
muted, or you can go, Morgan.
so we received like a 3-week break for winter, like right after finals between like fall and spring semester. And then we received a 3-week break after spring. No. Shoot, I can't remember if that was after spring or after summer. But I think that may or may not change with COVID. We currently, we're not going to have a spring break, but I think that our winter will stay the same at this point. I don't know how that kind of all looks for the future, but normally we do have like a summer semester. So
yeah, I mean, just echoing that, but yeah, it was after. So we had a break after our summer semester and then after our fall semester. But we go all through summer, and it's like not really like summer school. It's like summer school. It's pretty tough. So yeah.
All right, thank you. I think that this is actually talking about undergraduate, but let's talk about during your time as an undergrad and as a graduate student. Mitch, you don't have to answer if you don't want to, since you already answered typing. But how easy is it to make or keep close relationships with peers, close friends, and significant others with the workload and the time you spend preparing for professional school and while you're in professional school?
So, I think with anything, with any friendship relationship, it's usually on an individual basis type of scenario, but more broadly, I think, you prioritize what's important to you, and conveying that there might be a difference in needs to study, I think is important, just to be transparent. Open communication, but spending time with somebody can also look like studying with them some nights, if that's what it needs to be. I think that, friends and relationships that are there for the long haul are going to understand that there's a difference, and that this is a season and that it's not for forever. And so that would be my advice.
I think now where I am, and I think where we all are, it's you will generate really amazing relationships with people, and as you progress through school, especially in the graduate and professional school, you can be with these people all the time, and sometimes, just like Morgan said, it's in the form of studying, you're in the library together, you're at a coffee shop and whatnot, but you generate really close relationships with people really quickly. It's like you're in the trenches together almost, and you'll have those friends for life. I think what is a big regret of mine, and something that I would encourage a lot of you guys to do now, especially if you're about ready to enter, I did not spend as much effort on, you know, my other relationships that I had when I was an undergrad, and I stayed in touch with only a couple of people, and I wish I had done more of it, just because, you know, those people were just as much a part of my life as the people that are now. It's definitely challenging, but it's absolutely doable. And I think that's also a very wise thing that Morgan said too, is that the people that are closest to you, you know, I have a lot of friends that are in business, that are in dentistry, like just different paths, and they all understand, you know, what I'm going through, and it's a part of your life. And a valuable thing is like you get what you put into it. I think that's true for anything.
Yeah, so I've been pretty lucky and had, you know, where all my friends and family and everyone's very understanding. I think you need that because it's tough, and you know, some days I'm really mean because I'm really stressed, but people typically understand. And I also grew up here in Columbus, so I actually have found it super easy to stay close to my high school friends, because you kind of need an escape from school. So, you know, you're with your dental or medical students all day, and you'll be really close with them, but it's nice to have that escape. So I don't find it as hard to stay close with them because those are the people I tend to hang out with outside of school when I have time. So yeah, it's not terrible. I would say that undergrad is much easier though.
Great, thank you all for sharing. We didn't get any more questions when I did last call, so I do have one more for you. What is one piece of advice you would give to all new pre-health students, or if you want to look at it a different way, one thing you really wish you knew when you started out on this path?
I think the most important thing that I could tell you guys is just to echo what we've all said before about just being 100% true to yourself. You're valuable in your uniqueness and your individuality, and as hard as it may be to believe that, that's really what like graduate schools are looking for. And so it would be a shame to spend 4 years trying to be who you think they want you to be when they really just want you to be yourself. So I would pursue the things that you love, that you're passionate about, and where you enjoy like putting in your time and energy, and just kind of like letting the chips fall where they may, because you really want to be at the school who wants you for exactly who you are. And so that would be my biggest piece of it. Oh no, I said all of that and I was muted. Okay.
No, you muted yourself at the end.
Oh.
That's the same advice I was going to give. You're going to do a lot in undergrad, and you're going to do a lot that's going to end up on your application, but I wouldn't do anything just to put it on your application, because it's going to come off as phony. Like, they're going to read through it, and you're also just going to spend time doing stuff that like doesn't make you happy and stressful enough as is. So make sure like any extracurriculars or any volunteering you do or shadowing you do, make sure it's stuff that like you're interested in. You're doing it because you want to do it, not because it's going to look good on a piece of paper. And have fun in college. You know, you're going to do college one time. Don't have too much fun. Like, grades are still important. The end goal is ultimately like a graduate program, but definitely have fun. Enjoy college while you can, because it does get harder. So enjoy it now.
The first thing that came to mind for me was definitely like the individuality component, that exactly everything that Morgan said. And then the second thing was what Mitch said, is just have fun and enjoy the process. So the third thing, and I think maybe it's more important than the first two things I thought of, but yeah, just make time for the people that you love and hold them close. Get a support network, and that's it. I think I would have spent a lot more time and energy into it, especially where I am now. Miami is a great place. I still love the people that I met there. Yeah, hold them close.
Well, I don't have a fourth thing, but all those two are really good. And then just one thing to add, I don't think we mentioned, it's great if you're interested in a lot of things. And, we're saying to pursue what you like, but don't pursue too many. You don't want to like skim a bunch of different things. You want to like dive deep into a few things you really, really like, and really get involved or have a position or something. I wouldn't say more is better. It's like more of the quality than the quantity for sure. So just to add to all of that, but don't stress too much. They just be yourself.
Sorry, I had to turn my overhead lights on. They went off because I was sitting here for so long without moving. All right, so I want to thank all of you for participating on this. I really appreciate you sacrificing the time when I know it's a busy time for you. And as we all heard, your free time is valuable. Attendees, they've shared their contact information in the chat. They shared both their emails and their phone numbers. Please don't take advantage of them, but absolutely reach out if you have any questions or you want to talk to them about anything a little bit more in depth. Otherwise, this panel has been recorded. Everyone has said that that's okay. We'll be sharing it via Canvas here sometime in the next few weeks once we get it approved and edited down. And everyone have a great night. Thank you so much for attending and hope everyone's doing well with everything that's going on right now. Bye, guys.
Good luck. Thank you.
Good luck, guys.
Thank you for coordinating. Good luck, everyone.
Thank you.
Good luck, everyone.